Next topic is psychopharmacological interventions, psychopharmacological intervention and nursing management in Unit 5. What definition? Psychopharmacology is the branch of the psychiatric that deals with the use of medication to prevent, treat, and manage mental illness by affecting brain function and neurotransmitters. Psychopharmacological intervention refers to the use of psychotropic medication to reduce psychiatric symptoms, improve functioning, prevent complications. Objectives of psychopharmacological interventions: relieve psychiatric symptoms, restore normal thinking, mood, and behavior, improve daily functioning, prevent relapse and recurrence, improve quality of life, promote recovery and rehabilitation, reduce hospitalization. Classification of psychotic drugs. Antipsychotic drugs or neuroleptic drugs. Definition. Antipsychotic are medication used mainly to treat schizophrenia, psychosis, and severe behavioral disturbances. Mechanism of action: primarily block dopamine D2 receptors in the brain. Some newer antipsychotics also affect serotonin receptors. Then indications. Indication are schizophrenia, schizoaffective disorder, bipolar mania, delusional disorder, severe aggressions, psychosis associated with other conditions. Examples are typical chloropromazine, haloperidol, trifluoparazine, ତାପରେ ଆସିଲା ଯେ କି ଫ୍ଲୁପେନାଜାଇନ୍। ତାପରେ ଆସିଲା ଆମର ଏଟିପିକାଲ ହେଲା ଯେ କି ରେସ୍ପେରିଡନ୍, ଓଲାଞ୍ଜାପାଇନ୍, କ୍ୱାଟିଆପାଇନ୍, କ୍ଲୋଜାପାଇନ୍, ତାପରେ ଏରିପିପ୍ରାଜୋଲ୍। କମନ୍ ସାଇଡ୍ ଇଫେକ୍ଟସ୍ ହେଉଛି ଡ୍ରାଉଜିନେସ୍, ଡ୍ରାଇ ମାଉଥ୍, କନଷ୍ଟିପେସନ୍, ୱେଟ୍ ଗେନ୍। ତାପରେ ଆସିଲା ପୋଷ୍ଟୁରାଲ୍ ହାଇପୋଟେନସନ୍। ତାପରେ ଏକ୍ସଟ୍ରା ପିରାମିଡାଲ ସିମ୍ପଟମ୍ସ କ'ଣ? ଏକ୍ୟୁଟ୍ ଡିଷ୍ଟୋନିଆ, ପାର୍କିନସନିଜିମ୍, ଆଖାଥସିଆ, ତାପରେ ଟ୍ରାଡିଭିନ୍ ଡିସ୍କାନିସିଆ। ତାପରେ ସିରିୟସ୍ ଆଡଭର୍ସ ଇଫେକ୍ଟସ୍ କ'ଣ? ନ୍ୟୁରୋଲେପ୍ଟିକ୍ ମାଲିଗ୍ନାଣ୍ଟ ସିଣ୍ଡ୍ରୋମ୍ସ। ତାପରେ ହେଲା ଯେ କି ଆଗ୍ରାନୁଲୋସାଇଟୋସିସ୍ ସ୍ପେଶାଲି ୱିଥ୍ କ୍ଲୋଜାପାଇନ୍। Nursing management for antipsychotics ହେଲା ଯେ କି assess mental status before treatment, monitor vital signs, observe for EPS and NMS, monitor weight, blood glucose and lipid profile when appropriate, encourage adequate fluid and fiber intake, educate the patient about medication adherence, advise avoiding alcohol unless otherwise directed by the treating physician. Instruct the patient not to stop medication abruptly without medical advice. Antidepressants. What are the antidepressant medication? What are the antidepressant medicine? Definition: antidepressants are medication used to treat depression and certain anxiety related disorders. Mechanism of action: they increase the availability of the neurotransmitters such as the serotonin, norepinephrine and dopamine. Classification है SSRI. Example है fluoxetine, तापरे सर्ट्रालाइन, तापरे है एसिटालोप्राम, तापरे है paroxetine. SNRI, serotonin norepinephrine reuptake inhibitors. Examples है venlafaxine, duloxetine. सी रहा जे कि ट्राइसाइक्लिक एंटीडिप्रेसेंट TCA. एग्जाम्पल है एमिट्रिपिटिलाइन, तापरे इमिप्रामाइन। तापरे DMOI, डोपामाइन ऑक्सीडेज इनहिबिटर्स। एग्जाम्पल्स है फेनिलाजाइन, क्रिप्रोमाइन। इंडिकेशंस है मेजर डिप्रेसिव डिजॉर्डर, एंजाइटी डिजॉर्डर्स, ऑब्सेसिव कंपल्सिव डिजॉर्डर्स, पैनिक डिजॉर्डर्स आउ पीटीएसडी बा सिलेक्टेड मेडिकेशंस। साइड इफेक्ट्स है नाउजिया, ड्राई माउथ, कॉन्स्टिपेशन, वेट चेंज, सेक्सुअल डिस्फंक्शन, डिजीनेस, स्लीप डिस्टर्बेंस। सीरियस एडवर्स इफेक्ट है सेरोटोनिन सिंड्रोम, इंक्रीज सुइसाइडल थॉट्स इन सम चिल्ड्रेन adolescents and young adults during early treatment requires close monitoring. Nursing management for antidepressants. Nursing management for antidepressants assess mood and suicide risks regularly. Explain that therapeutic effects may take 2 weeks to 6 weeks to become noticeable. Encourage adherence. Monitor for side effects. Teach patients not to discontinue medication suddenly without medical advice. Mood stabilizer. Mood stabilizers help control mania and mood swings, especially in bipolar disorder. Example है lithium, sodium valproate, carbamazine ଆଉ lamotrigine. Indication है bipolar disorder, recurrent mania, mood instability. Side effects होची tremor, nausea, increased thirst, increased urination, weight gain. तापरे हमर आसला कि lithium toxicity symptoms. Severe tremor haba, vomiting, diarrhea, slurred speech, confusion, ataxia, seizures. Nursing management for mood stabilizer. Monitors serum lithium levels for lithium therapy, encourage adequate fluid intake, maintain consistent dietary sodium intake, monitor kidney and thyroid function as advised, educate the patient to recognize sign and toxicity and seek urgent medical attention if occur. तापरे anxiolytics, anti-anxiety drugs. Definition है these drugs reduce anxiety and promote relaxation. Example है diazepam, lorazepam, clonazepam, alprazolam. Indicators है anxiety disorders, panic attacks, acute agitation, insomnia. Side effects like drowsiness, dizziness, impaired coordination, memory problems, dependence with long-term use. Nursing management होचे कि monitor level of consciousness, implement fall precautions if necessary, avoid alcohol and other sedative substance unless prescribed, use cautions while driving or operating machinery. Do not stop a long-term benzodiazepam and abruptly and taper under medical supervision. Psychostimulants. Examples है methylphenidate, lisdexamfetamine, mixed amphetamine salts where appropriate. Indications है ADHD, तापर है narcolepsy. Side effects है loss of appetite, weight loss, insomnia, increased heart rate, increased blood pressure. Nursing management है monitor height and weight in children, check blood pressure and pulse, give medication as prescribed, monitor appetite and sleep pattern. General nursing responsibilities in psychopharmacology before administration. Assess mental and physical status, check allergies, verify the correct medication, dose, route and time, obtain baseline vital signs where appropriate. During administered, follow the medication administer rights, observe the patient after medication administration, monitor therapeutic response, after administrations, monitor for side effects, document findings, reinforce medication adherence, provide health education. Patient and family education. Explain the purpose of each medication, stress the importance of adherence, discuss common side effects and when to seek medical help, encourage regular follow-up appointment, advise against self-adjusting dose. Nursing diagnosis. Risks for injury related to medication side effects, deficient knowledge related to psychotropic medications, ineffective health management related to poor medication adherence, risks for falls related to sedation or dizziness. Thanks to all. Jai Jagannath.